organizing this Congress, and we talked that we will present the importance of healthcare travel globally, and we will give Jordan as an example. Well, first let us define what is healthcare travel. It covers all types of travel which has a primary motivation, the contribution to physical, mental, and or spiritual health through medical and wellness-based activities, which increase the capacity of individuals to satisfy their own needs and function better as individuals in their environment and society. More than 40 sectors benefit from healthcare travel industry. So it's not only healthcare system or hospitals or doctors. This is why we believe that healthcare travel is quite important from the economy on the worldwide. If we look at the size of healthcare travel industry or the wellness tourism in general, according to the Global Wellness Institute, the global wellness economy value $4.5 trillion US dollar. The wellness tourism itself more than 630 billion US dollar, and medical tourism itself more than 100 billion US dollar per year. In Jordan, Amman, we announced Amman Declaration. This was during the Global Healthcare Travel Forum in 2017. And in that announcement, we expanded the healthcare travel scope into 8 segments: medical, dental, spa tourism, wellness tourism, culinary, sport, and assisted residential, and accessible tourism, and I will go through them quickly. We'll start with medical, and as usual, medical tourism is the core of healthcare travel as we knew it traditionally. And here you can see the destination of medical tourism. So in Middle East, in Americas, Europe, Africa, and many others. So a lot of countries work in medical tourism. Jordan has been known in the MENA region as #1 medical tourism destination. We receive patients mainly from the region. And Jordan receive annually more than 250,000 patients with more than $1 billion US dollar income. Jordan has been known for its high level of security, political stability, and good diplomatic relationship with almost every country on earth. Easy access to Jordan. Most Jordanians speak more than one language, at least 2. The weather is moderate, and we have the largest natural spa, which is the Dead Sea. Jordan has been known for its advanced healthcare system since the early 70s of the last century, and we invested heavily in private hospitals. More than 60% of hospitals in Jordan are private. Not many countries are like that. And also, we apply a lot of quality assurance programs, including the international accreditation programs like Joint Commission International. And also, we invested heavily in our healthcare providers. We train them well, but also we have large number of physicians and nurses per population. So if you look at the number of doctors per 10,000 population, probably we are the highest in the world. Another added value for Jordan that there is no waiting time. The patients do not need to wait to do any procedure, whether it was diagnostic, therapeutic, or surgery. And this is very important for medical traveler. And the cost is quite important. In a study which was done in the US, 40% of the Americans said, I would travel abroad for a treatment if I save more than 10,000 US dollar, assuming a good quality. During COVID, of course, everything stands still, medical tourism stopped, but in Jordan, during COVID, in July 2020, we opened for medical tourism. So we launched a platform which allowed patients to come to Jordan during the COVID with certain rules and regulations and restrictions. But it stopped only between March until July. Jordan has been awarded the Destination of the Year for 2014, and Jordan was elected to be the president of the Global Healthcare Travel Council in 2015. If we move into dental tourism, again, this is another growing industry. A lot of people, they do not have insurance for dental care. some people, they have to wait for a long time, and more important, that is very expensive in certain countries. So a lot of people are traveling to do dental care. Spa tourism. What is the meaning of spa? It was derived from a Latin phrase called salus per aquam, mean health by water, either thermalism, which is like hot springs, or thalassotherapy, using the sea water as a form of therapy. And as an example, the Dead Sea. And in the Dead Sea, it is the lowest spot in Earth, and it's the largest natural spa, and it has healing powers. Being at the lowest spot in Earth, you will have concentration higher by 15% than the sea level. And for a treatment, you can use the Dead Sea products for the treatment of psoriasis, psoriatic arthritis, acne, lichen planus, and many other diseases. So a lot of patients go to the Dead Sea for a treatment. Wellness tourism is traveling for the purpose of promoting health and well-being through physical, psychological, and spiritual activities like meditation, yoga, and this is an example in Jordan at Wadi Rum. It's a very nice place for meditation. Culinary tourism. This is again a new evolving industry. People travel to improve their health through dietary food, healthy lifestyle through healthy dietary programs. They go to detox their body from drugs, from alcohol, from nicotine. They go to treat chronic diseases like diabetes, hypertension, hyperlipidemia, obesity. So there are centers now are offering this kind of programs for 3 weeks, 4 weeks, 6 weeks. During this time, you stick to a certain diet type and you can treat certain illnesses. Sport tourism, again, people travel to maintain their health by exercising certain sports, hiking, diving, any kind of sports, and a lot of these are available in Jordan. Assisted residential tourism. This is a broad version of ambient assisted living and planned retirement. For senior citizens who want to stay after retirement in a certain place, certain country, there are certain requirements they look for, including safety, security, good health care provided in that destination, easy access, and so on. So if a country wants to be a destination for this kind of tourism, they must fulfill the criteria to do that. And this is one of the resorts in Aqaba in Jordan. They are attracting this kind of tourism. Accessible tourism is the 8th type of healthcare travel, 8 segments, which is tourism for all. Is everybody has the access to go to that destination or to that facility? Well, this facility must be accessible for those with health-related limitations and needs. So, for instance, touristic places, if you look at this picture, is this a good place for a person on a wheelchair? So this is a requirement if you want to be accessible. What is the size of this market? The WHO estimates 1 billion people with disabilities. 15% of the population have some kind of disability. WHO and World Bank say that there is high correlation between aging and disability. Only 9% of European tourism suppliers, hotels, travel agents, you name it, have accessible facilities. So there is a lot to be done to make touristic service providers aware of the importance of accessible tourism. And these are some examples of access conditions for hotels, resorts, for spas, swimming pools, transport, cars, planes, airports. All these must be accessible to be able to benefit from this kind of tourism. Take-home message. Expanding healthcare travel is essential for any destination aiming to attract more visitors. Implementing healthcare travel 8 segments is a smart way to achieve that goal. You must bring all stakeholders in the loop. Invest in upgrading your infrastructure to be able to handle the 8 segments. Healthcare travel is one of the fastest growing forms of tourism. Thank you very much. And now, allow me to introduce Dr. Anthony Arias from Barcelona, Director of International Services at SGD Barcelona Children's Hospital, Secretary General of Barcelona International Hospitals. Currently, he is a member of the Executive Committee of Barcelona Medical Destination. With more than 25 years of experience in management and strategic planning, Anthony is a physician, PhD, and MSc in epidemiology at the University of Texas from Houston, USA. He followed the Advanced Management Program at ESAD Business School and Wharton School of University of Pennsylvania. Dr. Anthony will talk about the impact of COVID-19 on healthcare travel and medical tourism in specific. Please, Anthony.
Thank you very much, Dr. Al-Hamoudi. It's a pleasure to be here. Thanks for your invitation, and thanks to the IHF for allowing to make this session here in the Congress. So I will be talking about the impact of COVID-19 on the healthcare travel and its future prospects. I'm here invited to talk about the experience that we have in it, basically, at my hospital where I am working, and of course at Barcelona, where we have an association and a platform of several hospitals that have a vocation or aim to international patients. I am working in the Sant Joan de Déu, SJD, Barcelona Children's Hospital. Is a children and maternity center that was founded 154 years ago. Is a university hospital associated to the University of Barcelona. We are private non-profit. In fact, we belong to a religious order that is all over the world. But at the same time, we have a long-term agreement since 1973 with the public health system, and we belong to the network of public hospitals in Catalonia and in Spain. We are one of the most relevant pediatric hospitals in Europe in terms of patients attended and specialization. Here you have some figures. We are attending around 26,000 discharges, including pediatrics and maternity. And let me say that we all, in Barcelona, we have benefit from a long tradition of the biomedical sector. Since many years ago, we have big names in medicine, like Dr. Trueta and Dr. Barraquer in the beginning of the 20th century, and lately with Dr. Fuster in cardiology, that is the director of the Institute of Cardiology at the Mount Sinai Hospital in New York, and Dr. Massaguer, director of the Sloan Kettering Cancer Research Center in New York. So we all have benefit from all this tradition and history. And the offer that we have to all the patients abroad is made through a platform, public-private, called Barcelona Medical Destination, where we offer from preventive measures up to high risk and high complex disorders and procedures like oncology, cardiac surgery, neurosurgery, transplants, neurology, and neurosurgery, and as I told you, and fetal surgery, for instance. We are 13 centers that we are aiming to have services adapted to the international patients to offer around. And let me go to the point. what has been the effect of COVID-19 on traveling? We are aware, all of us, that COVID epidemic has been a high impact in the mobility among countries in the world. Here you have a figure of the number of tourists that visited Barcelona from the 90s until last year. And you see a tremendous and dramatic decrease of tourists that were coming here. We experienced a decrease around 80% of the tourists last year in 2020 due to the COVID. When we are moving to the healthcare, you know also that the hospitals that attended adult patients had a very high impact. However, Children's Hospital, in our experience and all over the world, the impact was quite low because children don't get the disease, don't get ill. So imagine that we had in 2020, all the year, only 168 admissions at the hospital, COVID positive. Only 105 were children. The rest were adult people that were admitted to the hospital as a support to the other centers, adult centers in the city. Of course, here we can see that the maximum peak of patients COVID admitted to the hospital, pediatric, were in April. But after this, we had some peaks that were coincident, of course, with the peaks of the epidemic that we have suffered in our country, but with a very low impact in our natural patients that are children at the hospital. Moving to the international patients, in our experience, and it is common, this experience, to all the other hospitals in Barcelona, more or less, with some differences, but nearly all had the same impact. We see here the number of requests for treatments that received by month, the demand that we had in 2019, 2020, and 2021. So what we can see is a very, again, dramatic decrease in the demand for treatment in the peak of the epidemic in March, April, until the end of May, approximately, and a persistent recovery, seeing that in 2021 we got more demand for treatments than before the pandemics. In terms of patients, we also experience a decrease of patients that finally arrive to the hospital. However, we observe, and there was a bet that we had, a different pattern for low, medium complexity patients and high complexity patients. You see here in the picture, in this picture, that the high complexity patients grow even in 2020, and the low risk and mid risk complexity patients decreased. So the high complexity patients move from 28% to 39%, and the mild and low medium complexity from 40% to 25%. So clearly, the complex patients arrive to the hospitals. This is our experience in our hospital and the others in Barcelona. I guess that was similar to other hospitals in the world. It was especially important, this fact, in oncology, pediatric oncology. It is is a rare disease, in fact, and it requires high specialization. So we experience even an increase of patients coming in 2020 compared with previous years from other countries. And probably the most significant and the most heart-pain was a case of a patient, an oncology patient from an Eastern country that arrived on April 1st last year, in the most serious peak of the pandemic. After a real odyssey, he was helped by a businessman, for instance, that offered his private plane to fly to Barcelona. We had all the collaboration of the consulates and embassies to arrive here. It was really an odyssey for this family, but the most important was the determination of the parents to get treatment for his kid. Which were the effects of COVID-19 on international patients? So, we have seen the decrease. And the effects were the postponement of travels caused by the fear. There were a very strong fear of traveling abroad. We have experienced this. And maybe we are still experiencing it. But it made a postponement of travels and the countries' lockdowns that we have all also experienced. It means closure of borders and airline connections, so nearly anybody during 2-3 months nobody were able to fly, except for the most complex patients, due to the difficulty, first of all, difficulties of connection, to find the flight, but also difficulties for visa and entry permits in our countries. In spite of the European Union authorization for humanitarian reasons to fly and to enter into the countries, there were a lot of difficulties that were sorted out. And also, it is a fact that affects the patients and their families, or whatever that wants to fly, is the perception of the safety of the destination. The perception of the safety of destination help to decide where to fly, where to go in this fact. So in order to make some actions, we use this matrix that was published by Nick DeMay, where they crossed the impact on the organization and the severity of the pandemics in each country. So we found that we would have a mild negative effect with a medium duration of the pandemic of 1.5 years, more or less. So we were ready to defend and improve our competitive position and find new growth. The measures at macro level were to suppress barriers to travel, simplification of visa procedures mainly, improving the timings of services difficult to the cost reduction, and support to the destination branding to make feel safe. At micro level, at the hospital, we worked on and focused on leading complex treatments, increased the teleconsultations, a customized approach to each patient, facilitating the visa entry, permits, accommodation, flights, etc. And keep a close connection with our facilitators, and a direct contact with the Spanish embassies and consulates for the visa and permits. So here you see the effect on the telemedicine activity of our hospital during the 2020. It tripled those previous to the pandemic. So to the question, will medical travel grow? We have found 4 estimations made this year. One is around 30% of increase. Another one, 19%. The third one, around 12% of increase. And the fourth one, 8.5% of increase. So with uncertain level and estimation of growth, we can say that the expectation is that medical travel will grow again and will keep growing with an horizon of 2026. But for the future, for this future to make it possible, it needs from the provider side a structure of knowledge and expertise, especially for complex medical disorders, facilities and technology, the investment ability of these providers, and to invest also in digital health. And from the patient side, of course, ability to pay and easy access to the destination. So, as a final thought, I based my last slide in a publication that was made by our colleague, Irving, that will intervene later, based on the WTO models for cross-border healthcare. And looking at this and their thoughts, so we believe that there will be an increase in supply of telehealth services. Seems that traditional medical travel will continue to grow, and probably we will see a redefinition of the strategy of location of big providers in other countries towards other models of collaboration in developing the healthcare abroad in many countries. So thanks for your attention. Let me show you this picture. Is our square, the hospital, where we have a sculpture of our a Catalan sculpture called Plensa. It's an international sculpture that lately opened and make the celebration of the a sculpture in New York, in the port of New York there. So this image is the soul, and is a soul to care of the patients made in 8 languages, with this global and international approach. Thank you very much.
Thank you very much, Anthony, for this informative presentation, which actually give us encouragement that your figures in 21 are even better than 2019. So this will be a point to be discussed with Irving, because he has something to say about that, but we will keep it later. But now we have to listen to our friend from India, Dr. Prem Jagyasi, who is an award-winning strategic leader, renowned author, publisher, and highly acclaimed global speaker. Dr. Prem is an author of Medical Tourism and Wellness Tourism Guidebook. He also ran a web magazine network of 50 plus niche magazines that attract millions of readers. Our friend Prem keep traveling, so I don't know where he is now, but at least we can listen to his talk about medical tourism leadership, developing mindful, sustainable, and viable business strategy. Please, can we hear Dr. Prem?
Good day, my friends. We are going to talk about medical tourism leadership, developing mindful, sustainable, and viable business strategies. You might ask me that why do we have to talk about the mindful business strategies in medical tourism? We all know the impact of the COVID on the medical tourism industry. In fact, that is going to be my subject, that what is actually the impact of COVID on travel industry and global healthcare industry, and together what is the impact on the medical tourism industry. When I talk about the impact, you will realize that how important it is for us to start thinking about developing more mindful, more sustainable and viable business strategies, along with how we are going to integrate the wellness strategies. So today I'm going to discuss that this COVID has created a massive impact on everything. Results are unbelievable of everything that we have done in our life and business and economy. Somehow, I guess medical tourism is blessed during this COVID that the inorganic growth of medical tourism has stopped right now, and now we have much more better idea about how we can develop more sustainable, more viable, more mindful strategies in medical tourism industry. But first and foremost, let's talk about why and what kind of impact this COVID had on entire tourism industry. We all know that more than 84% travel was stopped because of the COVID. And we also know that nothing is going to be the same before 2024. Even if we don't talk about new variable, even if we talk about high vaccination and all, still the industry is going to have a little slow rate in terms of coming back. What it means to medical tourism industry? The question is that medical tourism is a combination of two things. One is people traveling from one place to another place. So obviously there is a travel involvement. And second is a healthcare demand. But let's look at how COVID has impacted healthcare. You would surprised to know during the peak time, in just 12 weeks, 28.5 million selective or you call elective surgeries were postponed during the COVID time, during the peak period, 28.5 million. There was a time where in UK, United Kingdom, patient waiting time increased from 4 million to 10 million patients. 10 million patients were waiting for the treatment. In fact, there was a time in which in France, 75% people canceled their appointment. In fact, they delayed getting the medical treatment in US and everywhere in the world. And it's just not only about medical industry, even in the wellness industry, stress and anxiety actually tripled. The number of cases reported to the psychiatrist and psychologist were 3 times more. More than 15% people use drugs and substance abuse to deal with the COVID-related stress. And in fact, the inactivity caused 9% premature death. So, in general, COVID pushed healthcare even further worse. What exactly happened? And I need to explain you that during COVID, healthcare deteriorated. It went actually down. It went worsen. Why? Because the access to healthcare was not easily available. African patients who were traveling to India or other part of the world, they could not travel. Indonesian patients are not able to travel to Malaysia for the treatment. Middle Eastern patients who were traveling to Europe or Jordan and other places, they were not able to travel. And they could not get the medical services they want because the halt of the travel. But does that mean that they got recovery, or does that mean that they got treatment? We need to understand one thing. If someone wanted to go to honeymoon or a wellness retreat for a vacation, if he or she didn't go for that treatment, there was a loss of travel business for a week, for 10 days, for a month, and year. It was purely loss of a travel business. But in healthcare, if someone wanted a knee replacement, someone wanted a bypass, can they not do it? Can they really stop it? They can just delay it, but they cannot stop it. So it is not that that will not happen. In fact, that is the point in healthcare industry. The demand is there. In fact, demand is aggravated, demand is escalated, demand is elevated, demand has increased significantly. That medical tourism is going to grow far more bigger as an industry post-COVID, because people are waiting. There must be at least $80 billion of business waiting to happen in medical tourism. Now the point is, if the travel starts, and we know that travel is not going to start before 2024, and there are various reasons. The governments are not going to issue visas so easily. The vaccinations are not going to happen that fast. We know that in some part of Eastern Europe and some part of the world, the vaccination is not happening as fast as other places, right? And also we know the travel industry, the airlines are not coming back as they're supposed to be coming back. So travel is going to be slow. And the more slow we see the travel, what we will see, the more healthcare demand is increasing, more medical tourism demand is increasing, more number of medical cases are increasing, and that will put a pressure on medical tourism industry. Of course, there will be a time period that the most of the hospital who were getting a massive medical tourism business will not get it, and that is the reason why they need to focus on more viable industry, viable practices. And we have to talk right now why we need to do more sustainable. Let me give you first of all the definition and meaning of these terms about mindful business practices, viable business practices, and sustainable business practices. And also I will give you explanation why these are extremely important in today's point of view. Let me start with the most important point called viable. Viable simply means feasible, efficient, effective, result-oriented strategy. There was a time where the governments, hospital were spending crazy money in medical tourism and marketing. Few years back, there were lots of money by tourism board pumped into the medical tourism industry. Lots of events happening, lots of activities happening. Can those government, can those association, can those hospitals spend that kind of money again in marketing? Not really. So they need to have a more feasible efforts, need to have efforts which can they see as a return on their investment. So they need to have a more viable strategies, and that's why I'm going to talk about lean strategies. But viable simply mean that there has to be result oriented strategies, right? Second, I will talk about the sustainable strategies, which means now we are in a situation where we need to think about long term. The long term growth of medical tourism is very important at this moment. We cannot just think of pumping something right now, using resources, using or making medical tourism as a one-way street. It is not going to happen. So we need to have more lean practices in medical tourism industry, which means cutting down the wastage in the process, cutting down the huge markups, and making more better budgets in medical tourism industry, and making more sustainable industry so that the industry survive for long run. But you might ask me, what is mindful business practices, by the way? Mindfulness is about, whether it is a personal life or mindful business practices, is all about being aware. Being aware what kind of business you are in. Being aware who is your customer. Being aware what kind of contribution you are going to do. And being aware what kind of impact you are going to leave. What kind of business medical tourism is in? Well, we know medical tourism does generate lots of foreign revenue. We do know it brings lots of patients to international hospital. But this business is more about responsibility. It's about providing care to the people who cannot access, people who cannot afford, people who cannot get into the medical services in country, or they cannot trust healthcare in their own country. So you are not in a business of money making. Medical tourism is a very responsible business. Being aware about that is very important. Every month we get more than 3,000 patient inquiries. Even today we are one of the biggest lead generators in medical tourism. We share leads with various hospitals. You would surprised to know, no one send us a patient lead or patient inquiry that, hey Dr. Prem, we have $2,000, we want to pay you $2,000. Every single inquiry is about, my mom is suffering with some cardiac disorders. I do not have a means of treatment in my country. Please help me. I do not have money for my treatment for my son in my home country. Please tell us what you can do. Be aware who's your customer. Understand what are their needs, what are their wants, what are their demands, and what they are actually looking for. The first thing they are looking for, the empathy. They are looking for your sympathy. They are looking for your care. And most important, in medical tourism, customers are looking for solution. In medical tourism, solution are far more important than just talking about brand, talking about those big practices, talking about those big strategies and all. Customer, is actually, it's not a fashionable customer that he wants to wear new attire, he wants to wear new sunglasses, or he wants to buy that luxurious perfume. It's not that the customer. In medical tourism, the customer has a need and he has a want that he really wants to get the medical services from the best quality hospital at most reasonable, with the easy visa arrangement and easy to do activities and all. So your customer is actually looking for that kind of care which you can provide them. So being aware about what kind of business you are is the most important component. Somehow, when there was an inorganic growth of medical tourism, we saw interpreters jumping into medical tourism, those transport company, vehicle driven companies jumping into medical tourism. Nothing wrong, everyone can do the business. But medical tourism was not that organized, and probably we have got the time to understand that what kind of business we are into it. What is the contribution of the medical tourism stakeholders? The contribution is a better global healthcare infrastructure, better global healthcare stream. The contribution is to provide those global healthcare solutions to the patient who are suffering. And how we can do all that? We can do that with more openness. We need to be more open about understanding about different destination, different cultures, different geographies, different requirements and ethos and ethics of the business. Transparency has to be there. The quality has to be undivided. Quality has to be there in every single practice. We need to encourage more quality driven practices by government, by association. Care has to be at the center of everything, and we need to put more efforts on creating trust and capacity building in medical tourism. If we don't build the trust and capacity in medical tourism, we are not going to develop the industry the way we want to do it. So let's take COVID as a blessing, not literally in that sense, but for the medical tourism industry, that the pause that we have got, probably that's what we needed. We needed this pause to look back on our industry and see where we went wrong. Maybe we need to stop looking competitor as a competitor and maybe start looking them as a partner. Maybe we can have a more partnership. Maybe we can have a more viable strategies. Maybe we can develop more sustainable structure. Maybe we can look at medical tourism as a two-way street. So I think so there are great leadership challenges in front of us. How we are going to revive medical tourism. But more than those challenges are how to develop sustainable medical tourism. And I'm thanking Dr. Fauzi from Jordan to helping us to create this forum, and also the Hospital Federation and this entire conference and other speaker coming together, and entire organizations and the industry coming together and discussing how we can develop more sustainable, viable and mindful business practices. Thank you. Feel free to reach out to me and I will be available for question and answer as well. Thank you.
He is a well-known, wearable, recognized thought leader, global keynote speaker, and recognized business thought leader, mentor, advisor, and entrepreneur. With more than 25 years of experience, Joao's passion lies in helping others, sharing experience, transferring knowledge, working collaboratively, and helping businesses adopt the latest digital trends and health innovations, including artificial intelligence, robotics, and machine learning. We will listen to Mr. Joao talking about digital health during COVID and its impact on health services and medical tourism. Please, Joao.
Thank you so much for that brilliant introduction. Delighted to be here. Boa tarde, buenas tardes, and good afternoon to everyone in the audience presently, and to those in the live stream. It might be good morning to you. Many thanks to Dr. Fauzi. Dr. Antoni, and thank you for the amazing presentation so far. I'm actually going to start with a slightly different thing, if you don't mind. For my audience here, I'd like you to stand up. Be careful of the social distance. We are in COVID times. Just perform any stretch whatsoever. We're talking about healthcare, wellness, well-being. So I really want to get some energy through my body. I've been sitting for a long time. But also, I want you to engage with me and be really aware of my presentation and everything. So, brilliant. Sorry, Erwin, you got a bit of a tricky there. Thank you so much. So, delighted to be here, as I said before. My name is João Bocas from Digital Solutum, based in UK, Portuguese national. I've been in UK for 20 years, and lately I've been very involved in digital health and also in healthcare. And I'm here today to talk to you about the COVID times. I mean, the slides, they should come up now. Fantastic. So the impact on COVID on healthcare travel and these future prospects. It is my intention today to give you a bit of an overview at the intersection of digital health, wearable technologies, some emerging technologies. So I'm sure that you are aware of these things, but I'll give you a bit of an overview. But the big question is, what now? You might ask. And hopefully I'll address that by the end of the session. But let me start to give you a very short overview about our work at Digital Solutum. We are actually on a mission to cause global impact in society, people and humanity, and we have this mission of making healthcare uncomplicated with our work. Also some figures there. We existed since 2015. We've been 6 years in business. We have more than 15 years of experience due to my wisdom and well-being and everything, and also we have over 50,000 connections. But some of our work is around medtech, remote patient monitoring, some clinical research with pharma organizations, digital transformation, and digital health. And digital health market is actually a very exciting market. The global marketplace is expected to pass over $6 billion by 2026. And in 2020, for example, a very well-known company known as Babylon Health, they delivered over 1.3 million video virtual consultations, and the rise of telemedicine is here, as we can also see in Dr. Antoni's presentation in his work. And the healthcare industry is under tremendous transformation, with a lot of happening with artificial intelligence, machine learning, wearable sensor, robotic process automation, edge computing. Merging technologies are actually impacting our industry. And there are a couple of global digital health challenges. You might not see clearly there, but some non-communicable diseases are actually on increase. Very difficult to kind of keep an eye on them. And during COVID and the pandemic, some other challenges came along. Some further challenges as a result of the pandemic: the accessibility of health services. You might recall this very recently, where hospitals and clinics and healthcare facilities were actually closed or not accessible to patients. Additional pressures and increase on waiting times. We can actually see that in treatments and procedures. For example, in UK now we have really a backlog and a massive problem around addressing those on waiting lists for certain health conditions. And additional complexity on health procedures and on health systems. And I'll give you an example there, keeping patients apart from other patients. I'm going to give you a practical example. An hospital outside Lisbon, in the outskirts of Lisbon, had a really issue around keeping COVID patients away from the A&E, and it was only one entrance, and the COVID patients all of a sudden are amongst all the general patients. So very demanding. It's a bit beyond COVID. It's about infrastructure, accessibility, and all these things actually put more pressure on systems. And I mentioned before emerging technologies. What's new? I came up with this four-dimensional square, 4 pictures there. One was, I like wearables, you might know that if you know me. One was the first wearable ring from Chinese century in the 17th century. It was actually no electronics in that, but it was a very effective way to count by bit heads to do mathematical tasks. And one thing was certainly back there, no battery issues. On the very top, you see that lovely Panasonic mobile phone, the first ever Panasonic phones. They came out in the 80s. I was a very young man back then, worked for Panasonic in Portugal, and only the 2 managing directors had the mobile phone back then. It was like a dream to have a mobile phone one day. They cost about 2,000 euros, and they were not accessible. Now, most of us might even have 2 mobile phones, one for work, one for personal life. But also, I would like to draw your attention to that. A very well-known digital health influencer, Dr. Eric Topol, wrote a book where it turns the paradox on medicine upside down. The book is called The Patient Will See You Now. And he mentioned in his work that the mobile phone is the doctor in your pocket. So all of us now have a doctor in our pockets, we might argue. One of the other pictures there on the bottom is the hearings. So you're talking about wearables. Now they go in any shape and form, and also is well defended that to pick up heart rate and also other vital signs, that the temple in the ear is actually a very, very good place to do that. And then finally we have the Google glasses that for one reason or another they might come too early into the marketplace, then they didn't really fulfill their full potential. So some really good examples there. By emerging technologies, what's new in review, robotic process automation, we see the wearables, and even non-wearables, because things are moving really fast. We're entering a new phase where we might not even need wearables anymore. And I'm going to give you a practical example very soon. And some continuous monitoring with heart rate monitoring, smart toilets, smart rings, sensors. Things are moving really fast. And I'll give you another couple of examples there. On the bottom, we have an Aura ring in gold. We have smart shoes. And we have the smart toilet. Who would think about that a few years ago, where you could sit on a toilet, pick up some vital signs, heart rate, and do some kind of continuing monitoring. And that very tiny sensor is the smallest imaging sensor in the world. And there is the example with a facial recognition app called Anura by a company called Neurologics, and you can do some facial recognition of your vital signs. So the example that I mentioned before about not actually using medical devices or wearables is actually a reality now. I'm not sure about the accuracy, 100%, but innovation is moving extremely, extremely fast. And then what about wearables, their role in their value? Well, wearables, medical devices, in our case, because we're talking about healthcare, they can be used in disease management. Certainly in diabetes is disease management of a concrete condition and the concrete need that we need to keep an eye on that. But also they could be used in prevention, diagnostics, diagnosis, risk stratification, where we can access some level of risk, where we're going with it by gathering meaningful data, and early detection and prediction with also the support of other interventions. There is an example of a workflow of like a digital platform that has the patient side, the clinician side, but also with that, if we gather data and bring more data in with the use of wearables, is a concrete workflow for creating a care continuous loop, if you like. And then going back to the COVID travel and thinking about wrapping up, the impact on the economy, as has been mentioned before, is certainly a very big one. Mobility, the transit, future repercussions on traveling, which we are all still experiencing right now, but also for humanity, the impact on mental health deterioration. Many of us been stuck at home for quite a long time, even if we are busy working, but the mental health side of things, it will have actually an effect on society for years to come, to young and also adult populations. But further need for hospitals, healthcare providers to investigate new business models. And we're starting to see that in Europe. For example, in Germany, they have a reimbursement system. They're doing health apps and prescription for doctors, and the insurers start to get involved and interested in that. So is a lot of happening, a lot of challenging happening, but also a lot of things evolving, and we need to adapt. And COVID travel and digital health, we actually see the digital COVID certificates now, the digital consolidation, everything is digital. If you're not using digital, you're kind of missing the boat. And we see in the airports now, we need to scan our passports and our COVID things. And the digital health technologies to prevail, healthcare providers to adapt and transform rapidly, and the consolidation of essential digital skills are the norm amongst workforce. And I'll give you an example. I was actually talking to the Dubai Health Authority last week. I interviewed one of their leaders, and they have a very, very clear push on workforce development. And also in UK and other parts of the world, we're talking about addressing digital skills and closing the gap, educating people around being more digital. And in conclusion, our future, what's now? Well, the importance of collaboration is certainly very, very clear. Partnerships, we see big companies doing things with smaller companies. We're seeing them acquiring companies. We're seeing them closing gaps in their expertise, but also the need and the clear strategy to play to each other's strengths, because no one can solve it all. We need to collaborate. And the role of digital in all our affairs, I mentioned before, online forms, traveling, COVID vaccination, COVID proof, airplane tickets. And finally, I do believe, and you might agree with me, that recently we see health as our most valuable asset, our luxury product, if you like, much appreciated than ever, with 244 million cases of COVID worldwide, and so far 4.9 million deaths. Thank you very much.
Thank you. Thank you, Joao, for this interesting presentation. Actually, it's an eye-opening presentation that we need to learn a lot about the new technologies in healthcare. It gives me my pleasure now to introduce Mr. Erning Stackpole, President Stackpole and Associates from United States. Irving has 50 years of experience in healthcare, including clinical experience at Mass General Hospital, executive positions with global providers such as Tenet, and as consultant and entrepreneur. He is widely published in peer-reviewed journals as editor, co-author, and has been quoted in the Financial Times, New York Times, Forbes, and many others. He is fellow of the Academy of Marketing Science and has appointment with the European Institute for Innovation and Technology, Nova University, Portugal, and George Washington University at Washington, D.C. Stackpole and Associates work for governments, agencies, and providers in many countries on 4 continents. Let's hear Irving talking about way forward to the agile, responsive, and resilient recovery of healthcare travel. Please, Irving.
Thank you, Dr. Fauzi, and fellow panelists. Thank you to the Private Healthcare Association Jordan for making my presence here possible. This is all terrific stuff, and my role in this is to discuss with you some macro issues. So my role typically is as a strategist, And strategy falls into only a few buckets. So I'm going to focus on the strategic issues related to the bilateral shocks associated with COVID and recovery. So I'm going to talk about demand, supply, impact on the consumer, and I'm going to end at Dr. Fauzi's prompting with 4 predictions about the international market for trade in healthcare services. First of all, we had a demand side shock, as we've all talked about. The demand side shock is best manifest in the traveling public. And as we can see here, this is most recent data that I collected from Flight Radar. Commercial flights were dipped significantly in 2020, as we all know, and yet have returned very nicely and promise to return even more robustly. So the demand side shock is indeed recovering with regards to travel. As was mentioned by a previous presenter, there is pent-up demand in the medical markets. Tens of millions of surgeries have been postponed as a result of the pandemic. I would like to take a moment to correct one minor error, and that's that global disease burden isn't delayed. It's a constant in the epidemiological and demographic facts, and the people who didn't get served during the shutdown of both the supply, as we'll see in a minute, and the demand, as we've already talked about, those people may never get served. Some significant proportion of consumers who were not served but could have been served by medical travel simply will go without. The American Hospital Association, colleagues of mine at the AHA have predicted that 25% of elective procedures will just vaporize. They will go away, and they will not be manifest in clinical records. So we all know about the healthcare, the supply side shocks in healthcare. Supply was diverted. There were very few elective procedures performed. Countries and agencies like the private healthcare associations did all that they could to protect the capacity in order to meet the exigent demand related to the disease. And some percentage of that demand, as I suggested earlier, will not come back. So new supply is needed, and new supply categories, such as Joao was alluding to, will come online to meet some of that latent demand. The market for health travel, the market for health tourism, the markets for medical tourism, it's not an industry, it's not a sector, it's a set of highly fragmented vertical and regional markets where individuals travel for what they want or what they need. And as we've published and talked about almost forever, there is a volume acuity relationship in these markets. And as this graph attempts to depict, there is a high volume, low unit value side of the market, evidenced by dental tourism, evidenced by non-invasive cosmetic tourism, and there is a low volume, high unit value side of the market, evidenced by highly complex procedures, oncological treatments, cardiovascular interventions, etc. And there's an inverse relationship here, and those relationships are extremely important, and they're extremely important in which sides of the markets are going to come back sooner than others. Most of what we talk about in quote-unquote medical tourism really refers to mode 2 category of the general agreement in trade and cross-border services. And this is where an individual travels from one country to another country to consume services. But as you can see, there are 3 other modes, and I'm going to suggest in several of my predictions are built on the premise that the real future in international trade and healthcare services is not in mode 2. The future is in the other modes. We'll talk about that. So which of the segments of mode 2 will return soonest? Well, first of all, the first one to return was what my colleague and co-author Laszlo Puszko refers to as the hedonistic segment. This is the low-impact, high cosmetic, surgical, high personalized types of services. And we have clients where consumers were violating international travel regulations in order to get to where they could have their lips plumped, they could have their bodies buffed, they could have their fat cells removed, they could have their buttocks expanded, etc., etc. Why is that? The exigency of our self-image, I suppose. I'm not an expert in body dysmorphia, but I find the whole thing fascinating. The second part that is returning, and which Dr. Antoni and Dr. Fauzi referred to, are the high acuity consumers. These are individuals who will virtually do anything to get their child's cancer treated or their child's disorder treated in the location at the center that offers them the best hope. So these two ends of the markets for medical tourism are returning and to some degree have returned. So Dr. Fauzi also asked me to refer to the health tourist. Now the health tourist, that's a traveler, an individual who travels for health services. That's the WTO's definition. I don't particularly like that conjugation of terms because nobody who's seeking serious care is really a tourist. They are individuals who are driven to consume services elsewhere. But the health tourist's journey has been significantly impacted by COVID. Under the best of times, as this crude diagram attempts to say, consumers would go from the known to the unknown, bridging trust, bridging uncertainty. And that trust and uncertainty were critical variables in determining who would travel to consume care. Well, COVID has seriously impacted that, and now the question is, to what degree? And we have yet to measure this. Even though we've measured the degree of hesitancy, we've measured the psychological constructs associated with the willingness to travel, as was discussed about before. So I have just a few moments left to talk about the future of health travel. I'm going to make 4 predictions that A, Mode 2 GATS, that's the typical history, will be eclipsed monetarily by other modes. 2, access will become multimodal. João pointed us in that direction, and other speakers have talked about the importance of telehealth, virtual health, and we haven't yet discussed personalized medicine, which, in case you don't know what it is, I commend another of Dr. Topol's books. João mentioned the patient will see you now. Eric Topol actually also wrote a wonderful book called Deep Medicine, and I commend it to you as a directive as to where the markets are going. Prediction number 3, we're going to see the proliferation of technology, not airplanes. And prediction number 4, labor, workforce will be the critical components to the global healthcare markets in today and in the future. So prediction number 1, mode 2 will go down, but modes 1, 3, and 4 will absolutely increase. I know you can get access to these slides, so I don't want to drill down into too much detail. But telehealth, telemedicine is mode 1. Mode 3 is a commercial presence by providers in a remote destination. And then mode 4 is when the providers travel to the consumers in order to deliver care. I had the pleasure of meeting a colleague at dinner recently, Connie, who has spent the last decade traveling to those who need her services in order to deliver those services. And we will see more structure, organization, and exigency being created around such movements. Access will be multimodal. There's absolutely no reason why I have to sit in a waiting room in a hospital in Lisbon with 60 other people going up to the front desk 4 times for a wellness checkup. It's completely irrational. And as those of you who participated in one of the opening sessions around value-based healthcare, as value-based healthcare begins to rationalize, that W. Edwards Deming term for creating efficiency in healthcare, as VBC, as value-based care, starts to rationalize healthcare, we'll see far less waiting and far more efficiency. So access will be multimodal. We will see recovery and recuperation and rehabilitation managed with remote sensors, as Joao suggested. Prediction number 3, we're going to see a proliferation of technology. We're not going to see more people getting on airplanes to go to some other location in order to consume care. Yes, there will be a surge in pent-up demand, but that's not sustainable. That's not viable in the long run and will not be a key characteristic to the international market in healthcare services. Why would we? We can move the symptoms. We can move the diagnosis. We can move the knowledge and skills. Why move the consumer? Why move the patient? Doesn't make any sense. 4th, and this is a big one, labor is going to drive supply and demand in the international healthcare markets. The next shift, which is actually the title of a very good book, author's name is Winant, W-I-N-A-N-T. The next shift is from the service-based economy. So we had an industrial economy, we had a service-based economy. The next shift is to the caring economy. We've all read about the ineluctable demographics of aging. Look at 3 out of the 4 of us. We are aging, and that shift creates the need for care. Well, who's going to do the care? Some part of this care needs to be performed by individuals. In aging societies, especially the developed economies, where will the labor come from? So my suggestion is that the future of international healthcare will be to bring knowledge and skills to where the labor is, so that the labor can then deliver the services where the consumers are. And as I allude to here, I hope this isn't too cheeky, rare earth elements will be easier to find than a trained nursing aide. Mode 4, in that General Agreement on Trades and Services model, where the professional provider travels to where the consumers are, that's going to be the shift, the next big shift in international healthcare. There's going to be a rebound in demand, high volume, low unit value segments. These are going to be the most price sensitive. Not all these segments are, but that one is the most price sensitive. High acuity, low volume, high complex services. These will remain generally price insensitive. Technology will eventually drive down costs and prices, and I want to thank publicly my colleague Elizabeth Ziemba for contributing significantly to this presentation, and I hope, if I haven't scared you all into speechlessness, that we'll have good questions.
Thank you very much, Irving. Thank you. Anthony, what do you think about the projections of Irving? There will be a rebound, but it will not be sustainable. So there's a lot of investment in the healthcare travel industry, and your hospital is one of those hospitals that rely partially on the healthcare travel. So, do you agree or disagree?
No, in the long term, I agree that health travel will probably decrease.
Yeah.
For the reasons that Irving, I generally agree with his thoughts and his predictions, and I believe that now all over the world the health services in each country are going to be developed as the countries improve their development. So probably less traveling will be observed. However, in the next few years, I believe that still the most complex diseases that need a high level of expertise will still be served by the traditional model of flying. However, probably this model will be partially pieced in several stages and pieces, let me say. Many parts of the diagnosis can be made in each country. Maybe the highest complex surgeries procedures still will require to go to somewhere, and probably the follow-ups can be made in the countries where the patients are living. Mm-hmm. It means that probably we will see an evolution of this, but in short time, the more complex procedures, maybe we see a maintenance, let me say.
Thank you. Joao, do you think that your technology and the new wearables and all this stuff that you presented to us would affect healthcare travel in a negative way?
Well, yes and no. I think what happened with COVID really exposed some of the things that we could have been doing or should be doing with regards to, for example, remote healthcare.
True.
So I think I'm gonna, not to play devil's advocate, but I'm gonna say yes and no, because the technology is actually moving really fast. We have access to different types of solutions. So in a way, we don't probably need to go to certain places anymore. But at the same time, I think the healthcare traveling is also a very dynamic industry. And what I've been seeing in the marketplace is everyone is evolving and everything is adapting. So the digital health solutions are still maturing, such as wearables and the sensors and everything else. So nothing is really set in stone. I see a lot of things really evolving, but certainly exciting times and a lot of good lessons learned from the pandemic, really.
Thank you. Final word, Irving, because we are running out of time.
Well, I thought that, thank you, Dr. Fauzi, once again, and thank you all for being here. And I think you said in a private conversation just before we came into this meeting that there are certain consumers who still want the doctor's touch, who still want to be nursed.
True.
So we have an evolving, dynamic situation significantly impacted by the hydraulics of travel.
True.
Some membranes, I think of national boundaries as semi-permeable membranes, and the neurology of the membranes can be adjusted by government decree, by geopolitical stability, and we need to be opportunistic and take advantage of when the membranes are more permeable, and also to recognize that mode 2 international consumption is vulnerable, and the pandemic has shown us that. So the leaders in the future will adapt and deploy virtually all of the content we've talked about.
Thank you very much. By this, we finish the session. Shireen? Any question? I think everybody. Please.
Yeah, one question. So my name's Ismail. I'm from Detroit, Michigan, which borders with Ontario, Canada. I work in the Henry Ford Health System. And we have about 800 team members, nurses from Canada on our staff. So like 40% of some of our ER and inpatient shifts are staffed by Canadians. And so we had tons of issues, you know, as the border has been closed between our countries, making sure that our human capital could cross the Canadian border into the United States. And basically, you know, no Detroit-based hospital could survive without, you know, the Canadians that come across every day. There's about 2,000 nurses and some doctors. So I guess my question is, you know, from that perspective, do any of you have a perspective on how governments may collaborate to make it even easier for healthcare professionals to maybe practice in multiple countries? Do you see any countries working on creating, you know, a license that can work in Canada and the US and maybe France? Is anyone talking about those types of things, especially on the licensure side and education side, to make them consistent so that human capital can flow?
It's a very good question. Thank you very much. And so long Irving is working with governments, maybe you would like to answer.
It is a question, and it's at the bleeding edge of what's occurring now. And in the UK, they have the very analogous difficulty with regards to nurses from the EU.
True.
This is, frankly, a borderline embarrassing, potentially shameful situation between and among nations where healthcare professionals, in particular, not doctors so much, excuse me, gentlemen, not doctors so much, but nurses and therapists are indeed the critical enzyme to the solution of consumers' problems in a country. And the access to that enzyme is being artificially controlled by the governments. Now, in the U.S., we used to have an H-1A visa program that encouraged nurses to come into the United States from other countries. That program was suspended for political reasons. I believe that the healthcare organizations in the U.S. and elsewhere can and should take the political fight, take the fight to the politicians to create normalization of access through permitting. But as far as I know, there are no such standardized processes for cross-border, with the possible exception of the EU. Nurses can easily move across borders in the Schengen countries, but other than that, I'm simply not aware.
Thank you very much. Thank you, Irving. Thank you, guys.
May I ask Dr. Fauzi to come and present a special gift to our distinguished speakers from the Private Hospital Association? And we will start with Dr. Anthony.
I didn't know I was going to give to get the gift. Oh, my.
You can go in front.
Yeah. Thank you very much.
Thank you. It's my pleasure.
And of course, we have one for you. What? I said your name wrong.
Joao.
Wow.
That's brilliant. Thank you so much.
Thank you, Joao.
Thank you so much.
And for sure, Mr. Irving.
Careful.
Yeah, don't fall over.
Careful.
That would be bad.
Thank you.
Thank you.
Thank you, guys. Thank you very much.